For our final project, we will be discussing birth mortality rates in African American women in the U.S. This project is presented by Ering Brady, Sierra Cooper, Danielle Laperche, Kennedy Lowe, and Alli Rogers. Dr. Martin Luther King Jr. once said, "Of all the forms of inequality, injustice in health is the most shocking and most inhumane."
We will be discussing the disparities that women of color experience throughout their pregnancy, and especially while delivering birth at hospitals. We will closely analyze the rising statistics of women of color passing away while giving birth, and specifically why that happens. There are different factors that have been shown to be contributing factors to the issue, such as education and income. Specifically, the term weathering supports the idea of income being a factor of women of color experiencing these disparities throughout their pregnancy, and the rising rate of women of color passing away while giving birth. The impact that income has on the insurance that individuals have also contributes to the issue. We'll dive deeper into these contributing factors later. Statistics are shocking and highlight just how important and serious this issue is. For example, according to the CDC, Black mothers in the U.S. die at 3 to 4 times the rate of white mothers. This is one of the widest racial disparities within women's health. To put it another way, a Black woman is 22% more likely to die from a heart disease than a white woman, 71% more likely to die from cervical cancer, but 243% more likely to die from pregnancy or childbirth-related causes. In a national study of 5 common medical complications during maternal death and injury, Black women were 2 to 3 times more likely to die than white women who had an identical condition. Developing research also shows that the stress of simply being a Black woman in American society can take a physical toll during pregnancy and childbirth. This chart shows maternal deaths per 100,000 live births. You can see that not only are Black women twice as likely to face death during birth, but 3 times as likely. Black women are even more likely than any other woman of another race to experience maternal death.
Now that we've presented the issue, an important question rises in our minds. Why? No one seems to have a clear answer, but research shows that this issue stems from multiple factors. First, whether consciously or unconsciously, many medical professionals have a bias or discrimination towards Black women. In fact, 33% of Black women reported being discriminated against because of their race when going to a doctor or a health clinic. Furthermore, 21% have avoided going to the doctor or seeking healthcare out of concern that they would be racially discriminated against. Dr. Allison Bryant Mantha from Massachusetts General Hospital in Boston says, "Racism affects so many things before the patient even gets to the clinical encounter. Both implicit bias and structural racism affect how women are cared for in the healthcare system. The discrimination these women face now stems from a dark and disturbing history of exploitation of Black bodies for medical research, beginning all the way back in colonial times. Female slaves received painful surgeries without anesthesia, and children's limbs were unnecessarily amputated." Murphy and Simon Rudolph says, "This history of medical abuse of vulnerable populations continues to impact the willingness of communities of color to trust medical professionals and to both access medicine and enroll in therapeutic studies. Through fear and discrimination, Black women are receiving improper care or no care at all." Another factor leading to this frightening issue is economic and systematic barriers in society. While this problem does span Black women in all education and income levels, compared to white women, Black women are more likely to be uninsured, face greater financial barriers to care, and are less likely to access prenatal care. In fact, only 87% of Black women of reproductive age have health insurance. This is partially due to the issue of the coverage gap. Many women fall into the coverage gap because they earn too much to qualify for traditional Medicaid, but not enough to purchase insurance on the Affordable Care Act marketplace. These federal systems are failing these women. Only 30% of Black women are able to afford to take unpaid leave under the Family and Medical Leave Act. Therefore, Black mothers are more likely to quit, be fired, or return to work before they are healthy enough to do so. The economic and systematic barriers these women face affect their health and their pregnancies. Another important factor that adds to maternal deaths of Black women is weathering, a term coined by Harvard behavioral scientist Arlene Geronimus. She believed Black women experience physical weathering, meaning their bodies age faster than white women's due to exposure to chronic stress linked to socioeconomic disadvantages and discrimination over the life course, thus making pregnancy riskier at an earlier age. Many scientists did not agree with her claim, and she faced a lot of criticism in her work. However, in 1993, researchers identified a physiological mechanism that could finally explain weathering: allostatic load. The research found that chronic stress releases hormones and increases the blood flow in the body. When stress is chronic throughout a lifetime, the body needs energy to keep up with the increased blood flow. This causes the body to use energy from other bodily systems that typically would not be involved, including the ones that support healthy pregnancies. Furthermore, in the early 2000s, research on telomeres, protective caps on chromosomes, provided further evidence that weathering is not merely a metaphor, but a biological reality. The data showed each time cells divide, telomeres get a little bit shorter. They eventually reach a point where they can't divide anymore and they die. Allostatic load causes cells to divide faster to keep repairing themselves. The result is earlier deterioration of organs, tissues, essentially premature aging. With scientific evidence to support weathering, it is clear that this plays a large role in Black women's health and their pregnancies.
In relation to class material. Intersectionality studies the intersections between systems of oppression, domination, or discrimination. When one or multiple groups are left out of a discussion, it decreases their visibility and renders them helpless in incidences of oppression. This issue is extremely prevalent in the case of Black women and birth mortalities. As mentioned previously, rates of mortality amongst Black women are 3 to 4 times higher than that of white women, and this is regardless of class status. Rich or poor, Black women are dying at an extremely high rate due to unconscious biases. In order to understand why this is occurring, one has to examine all facets of social structures to better comprehend the complexity of this disparity. As you will see, intersectionality involves assessing the ecological systems theory that plays a major role into why unconscious biases exist that contribute to mortality rates. In Kim Pressner's TED Talk, she addresses how the brain forms unconscious biases by searching for patterns and creating shortcuts based upon cumulative effects of everything that a person has been exposed to throughout their lifetime. So if a healthcare provider has only ever seen or been told that Black women are lazy, poor, or don't care about their health, then they will treat them as such and be dismissive towards their claims of sudden illness because they see it as a side effect of the conditions in which they live. It's important for individuals in the healthcare field to understand that their unconscious biases towards pregnant Black women and during childbirth are negatively impacting their patients. Realizing that their biases exist and taking the time to truly understand the needs of their patients, regardless of race, ethnicity, or class standing, could save the lives of hundreds of patients. When looking at intervention techniques to fix the issue of African American women facing higher mortality rates in childbirth, we're going to use the ecological systems theory. Bronfenbrenner's ecological systems theory provides a clear framework to understand the intersection of factors that may impact our health. So the Bronfenbrenner's theory doesn't just focus on changing the individual behavior. It focuses on the dynamic interaction between the different layers that influence our environment. So when we use this theory to come up, we're going to come up with a multifaceted approach to fix the issue. instead of just focusing on one layer of the system. So basically I attached a picture, and this is the systems theory. Basically there's individual factors, there's the microsystem, the mesosystem, the exosystem, and the macrosystem. So where these systems interact ends up affecting the issue and how we solve it. We're going to start by looking at intervention on individual biases. So basically, we're going to work to get rid of cultural biases and discrimination in medical practices and medical education. So we can do this by making different mandatory training courses for medical professionals on diversity and inclusion and other issues like that, so that medical professionals are educated on the fact that they will have biases and that these biases are implicit and you need to know not to act on them. We also can increase diversity in medical care, specifically in maternity care. This could include hiring more women, more people of different races and ethnicities. These people will better understand the different patients, and it will also allow them, the patients, to feel more comfortable with them. If hospitals are not providing this unbiased quality care to all of their patients, we have to hold them accountable in some way, and this will help to let them know that they cannot get away with treating their patients differently based on their race or their gender. Looking at this issue from an ecological perspective, we also have to focus on structural changes as well as individual. So basically, women will earn too much to qualify for Medicaid, but they won't earn enough to be able to purchase their own insurance under the Affordable Care Act. So basically, they're in this coverage gap, and they are lacking access to health coverage and therefore can't afford the quality care that they deserve. And this a way that we can offer a solution to this would be expanding Medicaid coverage. So this would allow the maternal outcomes to improve by providing better access to the care and reducing financial instability.
In order to understand the differences in maternal mortality rates between minorities and white women, more research needs to be done. In Unit 7, Alison McGregor's TED Talk shed light on the fact that emergency medicine is tested only on men. A study revealed that 80% of the drugs taken out of the market are due to harsh side effects on women. For example, it was recommended that the dosage for Ambien be cut in half for women only because doctors recently discovered that women cannot metabolize the drug as quickly as men do. This led to women waking up drowsy in the morning and being put at risk when operating a motor vehicle while still groggy. Women feel that their concerns about their sexual reproduction health are often dismissed by doctors. Over 90% of women with chronic pain feel that their doctors and the healthcare system discriminate against female patients. In the article, Women in Pain Report Significant Gender Bias, a survey was conducted. The survey uncovered that 65% of women feel doctors take their pain less seriously because they are female, and 84% feel they've been treated differently by doctors because of their sex.